Councillor Freeman, do you wish to speak?
Yes. Councillor Robert Freeman. Mr. Mayor, in 1841, a young solicitor, Philip Rose, discovering that there was nowhere to treat one of his clerks with tuberculosis, leased Manor House in Chelsea to found what is now Royal Brompton Hospital. 3 years later, the hospital moved to Fulham Road and has been a part of our borough ever since. The history of the hospital is a history of innovation and of firsts. This year has been exceptionally challenging and for many has ended in heartbreak and tragedy. The contribution of the Brompton has been outstanding. As Councillor Henderson pointed out, it is only one of 5 adult ECMO centres in the UK. So many patients owe their lives to the treatment that they have received here. Many more will continue to need the Brompton later this year. The Brompton is and continues to be a centre of excellence in both the treatment and research of respiratory and cardiac disease. Only last week, a team comprising interventional cardiologists, cardiac surgeons and vascular surgeons performed for the first time in the United Kingdom a groundbreaking procedure to treat an aneurysm of the aortic arch of a 78-year-old patient. The Brompton is part of a network with Chelsea and Westminster and the Marsden, so the closure of the Brompton will degrade patient care in so many areas, including lung and thoracic cancer. It is an integral part of Imperial Healthcare Partners, a collaboration of the major healthcare providers and academic medical institutions in North West London. The research for which the Brompton is responsible is irreplaceable, and irreparable harm will be caused by its closure. This is not a merger. It is the destruction of an institution that provides irreplaceable healthcare and essential medical research. It is a statutory acquisition of the Brompton by Guy's and St Thomas's, technically under section 56AA of the National Health Service Act 2006. I quote from that section. Subsection B, the property and buildings of the acquired NHS Foundation Trust are transferred to the acquiring NHS Foundation Trust. Subsection C, the acquired NHS Foundation Trust is dissolved. Subsection D, where the acquired trust is an NHS trust, the NHS Trust order establishing it is revoked. In simple terms, that is the end of the Brompton. The Foundation Trust would no longer exist, the board would be gone, the governors would be gone, and many of the wonderful consultants who carry out groundbreaking treatments and research will leave. We as a council will no longer have a voice or input into the services for our residents. We are told that this will be a gradual process that will take 10 years for the Brompton to move to its new site in what the NHS insists on calling Westminster. Geography is obviously not their strong point. It is, of course, in Lambeth, not Westminster. Beginning with children's heart surgery, there will be a steady leakage of services out of RBKC to Lambeth. These services are interdependent. Move children's heart surgery and the paediatric intensive care unit becomes unviable. Then you lose more and more skilled specialists since their work is no longer viable. So what can we do? The first thing is to ask the Trust to come to scrutiny and tell us what is really happening. We need more information, a lot more information. Has an approach been made to the Competition and Markets Authority? If so, with what result? Has NHSI carried out a risk assessment? If so, again, with what result? How is this takeover affected by the CQC rating that Guy's and St Thomas's, although rated good overall, requires improvement for safety? Yes, safety. Has NHSI carried out its strategic case review? Where is the business case? There is an immediate intention using NHS jargon to reconfigure services in North West London. When are we going to be allowed to scrutinise these? And what part of the mandated consultation with patients and residents has been carried out? The Brompton was my charity when I was mayor. I have the greatest affection for this institution.
1 minute, please.
And the people who work there. Time and again, it has been shown that specialist care has the best outcome. There are times when the duty of a good friend is to say, sorry, but you're making a great mistake. Stop now before it's too late. We as a council must make it clear that these proposals are totally unacceptable, that the takeover will cause irreparable damage to our residents, and that their health care and that of the Brompton must remain independent and in our borough. Thank you, Mr. Mayor.
Thank you very much, Councillor Freeman.